Today, let's talk about the term emergence in anesthesia. Emergence is the process of transition or waking up of patient from unconsciousness due to effects of general anesthesia on that patient. It is a very critical phase that requires professional experience because it involves gradual return of patient's reflexes, including the ability to breathe on their own, to maintain stable heart rate and blood pressure, and to regain mental awareness. The very goal of emergence is to have a smooth waking up of our patients, but certain complications like agitation and delayed recovery can sometimes happen. The process of emergence. How does emergence goes? At the end of every surgery, the first thing the anesthetist does is to discontinue the inhalational anesthesia agent. This will help to stop further concentration in the lungs. Continue oxygenation to clear the lungs and the blood circulatory system. Suction the oropharynx to clear the airway and to avoid aspiration. This also helps to stimulate the patient to waking up. Observe for patient respiratory efforts in the reservoir bag. And when the patient's effort is good enough, give your reversal drugs. Reversal drugs are drugs that dries up secretion and counteract the effects of neuromuscular blockers that were used, usually atropine and neostigmine or glycopyrrolate and neostigmine. The combination may vary between facilities and as the patient begins to be conscious and aware and can respond to verbal command, extubation is done with oxygen and suctioning the oropharynx. Continue supplemental oxygenation using face masks and then monitor the patient's vital signs to see that the patient is doing well. At this point, the patient begins to be very conscious and aware. Then emergence is said to be done and smooth. Emergence is not without complications, like we said. In some cases, we have agitation and delayed recovery. So in our next video, we'll talk about some complications of emergence. Please, if you find this video very helpful, kindly subscribe, like, share, comment, and follow so that other people can also have a link to see this video. Thank you. Until we have you again in our next video.